I am thankful to DGHS and team from Central Health Education Bureau and DDG Ayush, Dr. A. Raghu sir, working at Ayush Vertical, DGHS, MOHFW. Myself, Dr. Virendrakumar Bhakare. I am working as Assistant Advisor in Ministry of Ayush and looking after the work related with National Ayush Mission Land, coordinating with state and UT governments, especially Ayush departments in the states and UTs. The topic allotted to me is what is musculoskeletal disorders related program under National Ayush Mission NAM and how it is to be implemented by the in a program mode. This is not working. How many of you knows about National Ayush Mission NAM? I think very few. You know? You are aware? Okay. National Ayush Mission is a centrally sponsored scheme which is launched in 2014 and Union Cabinet has approved its continuation till 25-26. During the meantime, one new component added in National Ayush Mission NAM, that is operationalization of the 12,500 Ayushman Arogya Mandir Ayush. Earlier it was known as Ayush Health and Wellness Centers, but now renamed as Ayushman Arogya Mandir Ayush. So under this scheme, there are two major components. One is Ayush services and second is Ayush educational institutes. So we provide support for Ayush services and Ayush educational institutes. Some flexible components are also there, and we also provide support for the admin cost at the state level and district program management unit level. There are financial provisions, and as per the provisions we provide. This is a centrally sponsored scheme, so state and central share ratio is involved. For the general states it is 60:40%. For the northeastern states and hilly states and UT of Jammu and Kashmir it is 90:10%. For union territories without legislature it is 100% and with legislature it is 60:40 again. These are the components and activities under National Ayush Mission NAM. Major components are Ayush services and Ayush educational institutions. The activities are
slide can be switched off. It's reflecting over the screen. This one. So this light, if it can be switched off.
this light ये कह रहे ऑफ करना है, देखिए नहीं ये वाला okay, thank you. So these are the components and activities. First one is Ayushman Arogya Mandir. Ministry has a target to operationalize 12,500 Ayushman Arogya Mandir in throughout the country. So we have already approved as per the proposals submitted by the state and UT governments through their respective state annual action plans. So 12,500 Aam Ayush has already been approved, and out of that states, UTs, governments have reported that 12,033 Ayushman Arogya Mandir Ayush are operational. So we are following up with them for making remaining units also functional. Co-location of Ayush facilities at PSCs, CSCs and DHS. So co-location means it is a dual control actually. The manpower and their training is provided by Ministry of Health and Family Welfare under NHM, and we Ministry of Ayush provides support for medicines, infrastructure development and contingency funds. Upgradation of existing government Ayush hospitals and dispensaries also. The dispensaries which are available in the government sector We provide funds for upgradation, that is 20 lakhs. Even for construction of the new dispensary also, a provision has been included, and Ministry of Ayush supports for 30 lakhs. The land must be available with the concerned state UT government. Then supply of essential drugs to Ayush hospitals, dispensaries, and even teaching institutional hospitals also. For hospital dispensaries, hospitals it is 5 lakhs, dispensaries it is 3 lakhs per annum, and for teaching institutional hospitals it is 15 lakhs per annum. Then setting up of 50, 30, 10 bedded integrated Ayush hospitals at Raghu sir, as Raghu sir already told that 137 integrated Ayush hospitals we have already approved under NAM, and out of that 38 are operational as on date, remaining are at various stages of construction. So we also expect to follow for construction projects and have a talk with your Ayush department if these projects are sanctioned in the vicinity where you are working at present. Next is, sir.
अपग्रेडेशन के लिए बोल रहे हैं, it is per annum or one time?
No, upgradation of existing standalone government Ayush hospitals, there is a provision of financial assistance of 1 crore per year for non-recurring assistance. Okay. Then there is provision for medicines for 5 lakhs, contingency 0.7, 70,000 per hospital. And we also support some manpower like consultants, attendants, for upgradation of the Ayush hospital. If the regular manpower is not available with the government and some posts are vacant, so we also provide support for their remuneration also. For upgradation of Ayush dispensary, I said 20 lakhs, and for construction of the new dispensary 30 lakhs we provide. Even the dispensaries are in dilapidated conditions, that for that also we provide financial assistance. Then Ayush public health programs,
Have you kept the idea of population density in your mind before going to before making all these things? The density of the population is equally important. Some places are there where the Ayushman Mandir has been located, but unfortunately there the population density is very less. If you are going to get that much of big setup over there, what is the use of it?
no, we have, for that purpose, we have already framed up Indian public health standards for the Ayush facilities, and in that we have also taken care that population criteria may also be taken into consideration by the state UT governments also before establishing the said new institution, because already established is there, we cannot do anything. But if you have to set up a new hospital, then IPHS standards will help you. Yes. There are 8 dedicated Ayush public health programs we have incorporated in National Ayush Mission guidelines from 21, and the scheme is continuing till 26. Ayush educational institutes.
What are the things and component of public health program?
There are 8 public health programs. I will explain in the next slide also. Under Ayush educational institutes, we support for upgradation of the UG and PG institutes. For UG institutes, it is 5 crores, and for PG institutes, it is 6 crores. This is totally non-recurring assistance for infrastructure development, construction of boys hostel or girls hostel, or some required equipments or instruments in the teaching institution hospital. 6 crores for the PG. Then establishment of new Ayush college, where it is not available in the government sector, or available but it is in inadequate number. So we are supporting for this purpose also.
So, the establishment of new Ayush colleges, there are NAM guidelines.
Yes,
that.
yes.
The square meter area you have mentioned.
Yes.
Actually, we are going for the new college in JNK. If you know that, the UT of JNK. The problem is coming in that sense. You are giving a guideline of 2,000 square meter for the college building. But if you go by the MSR given by the you can say NCH, it's not. You can say
How much it is in?
If we go by that thing, it is going up to like 3,000 square meter, and that too without having the walk through area and staircase area. This is the main issue which is coming in our state also.
No,
because in your guideline you have given the set criteria of 2,000 square meter of college building, 2,000 square meter of this hospital. But if we go by the MSR, even NCH, because the inspection will be done by the NCH. So the executive agency is being confused by these two.
So I will get back to you personally also. After completion, I will reply to your answer, to your query. Then these are some flexible components also, like yoga wellness center, telemedicine, sports medicine through Ayush. We also provide support for training and capacity building of the human resource. Then support for HMIS and DBT tracking system also, and NABH accreditation of Ayush healthcare facilities. Someone inquired about the quality assurance. Sir, we have already, Ministry of Ayush have an MOU with Quality Council of India through its board of accreditation, like that is NABH. So we are assessing Ayushman Arogya Mandir Ayush at first instance. 2000 has been chosen, and out of that around 1300 Ayushman Arogya Mandir Ayush have been assessed, and 591 have been certified for Ayush entry level certification by the NABH.
Sir, can you elaborate about the sports medicine?
What is?
Sports medicine through Ayush.
Sports medicine through Ayush, that we received proposals from during the implementation of the National Ayush Mission NAM. We received from proposals in under Flexipool from governments like Kerala, Karnataka. So they support their innovative ideas under Flexipool.
Support the, it will be incorporating the Ayush streams with the physiotherapy, like.
No. In respect of sports injuries, they are using our Ayush medicines. So they propose their innovative ideas under that. So we always support to the state UT governments. Yes. Telemedicine, actually, we have requested state and UT governments to decide a hub and spokes. So even we received a communication from the NHM department that in their health and wellness centers, Ayushman Arogya Mandir, many Ayush doctors are deployed, and some centers are there where BSc nursing candidates have also deployed. But the BSc nursing candidates are using teleconsultation services, and then they are providing medicine to that particular patients. So for yes,
Clarify that thing also.
आयुष में टेलीमेडिसिन पूछना था.
yes. So on the same pattern, they have also requested us, if the patient coming to the modern facilities and they need Ayush treatment, then how they will get treatment from our side. So for that purpose, state UT governments have to map their facilities. They have to decide what are the hubs, what are the spokes, so that teleconsultation facility can be provided. This is the purpose.
When you say Ayush, no sir, most of the fund and most of the programs are engulfed by Ayurveda. So you are not specifying which system is providing these facilities. So what we request is, no sir, it is happening.
Sir, it is, देखिए sir, it is Ministry of Ayush. ठीक है.
No, when
During
it comes to state, most of the programs, whatever telemedicine you are telling, sports medicine you are telling, most of the programs will be implemented and the most of the funding will be taken by Ayurveda. So if
Sir,
the guidelines
90%
comes from the
funding
ministry, that will be helpful for each system.
Sir, under the guideline, there are provisions for each system. We are supporting for medicines for homeopathy also, for Unani also, for upgradation of the Unani hospitals, for upgradation of the homeopathy hospitals. But whatever the proposals comes from the state and UT governments, through their governing body approval, through their annual action plan, that is placed in the
You are
meeting.
accepting the proposal from state.
Yes.
So whatever proposal comes from state, it is the majority is from Ayurveda. So if you specify the percentage of funding to each system, then it will be helpful. Otherwise,
प्रपोजल आयुष के थ्रू आता है.
Sir,
प्रपोजल आयुष
otherwise
के
it
थ्रू आता
will
है.
be masked for other system.
what I am saying, sir, public health, as per the constitution also, public health is a state subject. They have to decide what their requirements, that can be discussed in the meeting. You have to discuss with your Ayush directorates.
No, some of
Your
the-
director ki
some-
these proposals are of
what we are
homeopathy.
requesting is some of the components should be reserved for homeopathy. Then only it will be implemented. Otherwise, if you generalize the components with all the Ayush system, the problem will arise once again. Which system should adapt it?
स्टेट्स के अंदर नोडल जो है ना आयुष
नहीं,
The majority, sound will come, the majority person who is there in the
We are
meeting.
fully agree with this concern, doctor, because on the ground level, the equal distribution of the funds as well as the medicines are not being done.
Yes.
This is mainly only on the paper only for PPT.
No, no.
Whether sports medicines as well as telemedicines or the Mandir you have told about Ayushman Arogya Mandir and all. The things are not being implemented at the grassroots level.
No, no, no. This
It
is
makes
not.
no sense then.
This is not only
This
for the
may-
KPD.
this
I will explain, sir.
Explain.
We have already supported establishment of new educational institutes which are from the homeopathy stream also, which are from the Unani stream also, and which are from the Ayurveda also, even Siddha also. So whatever the proposals submitted by the state governments in their kitty resource pool that we allocate to the state UT governments, we always agree, sir.
आयुष्मान आरोग्य मंदिर आयुर्वेद के होम्योपैथी के यूनानी के कितने कितने बनाए गए हैं?
आयुष्मान आरोग्य मंदिर 12,500 है. I don't have the bifurcation as of now, but I will explain to you.
So one more thing, you are
So
talking
the
about
guide-
Ayush streams in most of the UTs and states. There are confusion being arisen just because of you are incorporating MSc nursing also in this thing. Most of the states are not allowing our Ayush doctor to prefix doctor with them.
Yeah.
And it is in written. Order has been issued in written. To those you will not write doctor in front of your name.
Sir, in our Ayushman Arogya Mandir, sir, no BSc nursing candidate has been deployed.
But in our UT, they are nursing staff, GNM also, they are at the level MLHP. They are not giving them the, you can say, nomenclature CHO. They are, you can say, engaging them as a MLHP. And they are asking our Ayush doctor not to prefix doctor with them.
So why
No, no.
Because,
sir,
sir, you should clarify from the center this thing to the each state. Because I have been working with the NHM and with the state government also.
Sir,
same thing is happening in the Uttarakhand also.
In GNK also.
Suppose you have given other type of CHO, in another department like in allopathic medicine, they are using the CHO, the staff system.
Staff
is
system.
CHO word. This is not correct, sir. This is not.
And from that thing, they are just issuing the orders like
I think
draconian orders like don't. fit
I
with
think
doctor.
let me complete first. Then what are your suggestions after the
These
completion?
are not the suggestions. If you will talk, I mean.
No, no, no.
Equally, we will.
You can give your suggestions in written, so that I will give the feedback to the higher authorities in the ministry also. And
So many.
Sir, very latest example I would like to share with you by the state government of Haryana, last month, just a few days ago. The demand for 2 protocol officers have been required, in which BMS, MBBS, BDS, CHO, but there was no mention about the homeopathic doctor. The protocol officer or license officer was required for the CM of Haryana, but the request was demanded from BDS, BMS, CHO or MBBS, but no name was given for homeopath in the PGI Chandigarh.
Sir,
So why is such discrimination?
so for this UT government has to take a call.
The guideline must be drafted by the NAM, we are saying, Nationalized Mission, that is Government of
I'm
India.
sorry to interrupt. So can I have the discussion after the
Yes.
session? So let sir
Then
continue.
no use, ma'am. तो सुन के चले जाएंगे.
No, once sir complete the session, then we can have the discussion.
No, no.
We have more than 18 years experience. I passed out my MD in 2005. यदि हम डिस्कस नहीं करेंगे तो उसका यूज नहीं ना मैम.
Let him ask.
Means let sir complete the session and then we can have discussion. Yeah, we'll take it as a
No, no, डॉक्टर साहब
Sir,
देखो
we have a session.
रिक्रूटमेंट जो है यूटी गवर्नमेंट को करना है, ठीक है ना?
गवर्नमेंट ऑफ इंडिया ने देना है.
The guideline we have already given, sir. We have already given regarding Ayushman Arogya Mandir also.
We are expensing.
Even orientation has also been given to the all the community
officers.
officers. Okay, okay, okay.
So we have a feedback session at the end of the day, so we can have all these queries addressed over there.
सर वो वाला थोड़ा सा
Thank you.
रिपीट करेंगे क्या?
कौन सा बताइए?
जो a person goes to the district hospital or somewhere, if he wants to have some kind of teleconsultations, one staff nurse will be there.
No, no. For that purpose, no, sir, specific equipment is also there. For that we provide.
E-Sanjeevani is running throughout the country. They can take help of that. I am asking that, have you ever mentioned that you will put some kind of staff nurse or BSc nursing there who can help it?
No, sir, that has been not mentioned in the guidelines, but what is the requirement under telemedicine, under flexible state government can propose us, we will definitely support, sir. The idea is just to have a teleconsultation in between the pathies and cross pathies also. This is our suggestion, sir. These are the 8 Ayush public health programs, sir. And first one is National Program for Prevention and Management of Osteoarthritis and other musculoskeletal disorders. Then one NPCDCS program which was already running in the 6 states. Earlier it was in a pilot mode. This program has been included in National Ayush Mission NAM in a program mode.
Sir, this program I think nomenclature has been changed or what? This is now NPNCD.
Yes. This is now National Program for Non-Communicable Diseases. Yes, the nomenclature changed by the health.
It was NPCDCS.
Yes. But it was already in the guideline during the year 21, so I cannot change the name. No. Integration of Ayush. This was running in 6 states earlier. I think Rajasthan, Gujarat, and Bihar. It was for Ayurveda. And in Uttar Pradesh for Unani system, and West Bengal and Andhra Pradesh for homeopathy system. One is Darjeeling district of West Bengal and Andhra Pradesh, one Krishna district.
All these programs are under Ayurvedic only.
No.
All programs are Ayurvedic.
All these programs are for all these streams.
Sir, there is some standard protocol or guidelines for homeopathy.
Because you are the competent administrator.
Sir,
we are pouring our.
Your point has been noted down, but guidelines are in a way that state can propose any stream, any system, any pathy.
Sir,
So this is not.
So unless and until you
No, your problems are with associate. What I am thinking now, your problems are related with the your interactions at the Ayush department in your state and UT level. Even recruitment is also to be done by the concerned state and UT governments.
They are
Public.
the guidelines of the National Ayush Mission of the central government.
So,
This is the reason.
in
They are saying everything is written by the New Delhi Ayush Ministry. This is the things we have to follow this.
The guidelines are very clear, and state and UTs can deploy the doctors which are available in their states. For example, in Tamil Nadu, we are supporting the Siddha system also. In Jammu Kashmir, Uttar Pradesh, we are supporting the Unani system also. In the northeastern states, their proposals came for the homeopathy system, so we are supporting for that. And for Ayurveda, if the states are proposing more proposals and that are as per the guidelines, that also we are supporting.
Sir, just a second. I'm sorry for interrupting. What I meant to say ki, perhaps all of us, most of us will be agreeing,
Sir.
that whatever facilities are being given by the NAM, these are being polarized to a particular system. I would not like to mention the name of the system. It is being polarized. And please listen to me. And my humble request to the authority, since you are the part of the authority, that your part doesn't finish by doing these guidelines. It is you who has to ensure that these are being followed.
Sir, for that,
Sir,
I will explain.
Sir, let me complain, sir. The thing is, National Ayush Mission has framed this thing, guideline. Now, this is responsibility of the National Ayush Mission, that whether your instructions are being followed or not. If not followed, what are the chances or scopes? Secondly, since Ayush has got 5 components, so wherever the, as you said, prevailing this thing, that has to be given more importance. But it is very unfortunate, and this is very fact, that this is being polarized. So my humble request to your good self, please look into the matter in the next future.
Firstly, I will say during the last year, we have made teams from the Ministry of Ayush, members from the concerned research councils in your states and UTs, and some senior officers of the ministry also. And we went to each state, we visited some facilities, we have reported the shortcomings also. Even the Niti Aayog Niti Aayog has also done evaluation of 7 umbrella schemes, including National Ayush Mission NAM, and we observed certain shortcomings in the states and UT governments. That shortcomings we have communicated to the principal secretary level officers in your concerned states and UT governments. Further, Niti Aayog is also evaluating the implementation of the National Ayush Mission NAM. We have communicated to the states UTs to do it at state level. Then central team will also go there for analyzing the things, what is happening at the ground, and then Niti Aayog will also evaluate. So this is under consideration by the ministry, sir, already.
Thank you, sir. And from the deepest core of my heart, I'd like to thank. And please ensure that your guidelines are being strictly followed.
Sir, guidelines are in the public domain also. When we share the guidelines with the states and UT governments for their comments, so we received very few comments from the states and UT, which have been already incorporated. Earlier it was till 2014 to 2020, the guidelines were same. But when the revision of the guideline was done, we shared the guidelines with the states UTs for their comments. And after receiving the comments, this has been done. Yes, sir.
Again,
Sir,
so can we have the question and answer session at the end of the
Yes.
talk so that it won't get disturbed, and we have a shortage of time now.
Yes.
We'll have to complete this session by 12 o'clock.
Thank you. Then this is the background of the national program, why it is included in National Ayush Mission NAM. You can see majority of the cause of the morbidity, major cause of the morbidity. Then degenerative changes in the joints, commonest cause of restricted movement. This is the second thing. Third, MSD represent a burden, direct cost to the healthcare system and indirect cost through loss of work and productivity. As per the reports, the global prevalence of MSDs in some countries it is 14%, in some countries it is up to 42%. Then community-based prevalence is about 20%. This is as per the epidemiological study reports. Occupation-specific prevalence found is to be 90% in various studies. WHO also estimates that 40% of the people over the age of 60 years suffer from MSD, and about 80% of the people have had low back pain at some point in their life. So keeping in view these points, and one point is 1.71 billion people have musculoskeletal conditions worldwide. This is as per the Global Burden of Disease 2019 report published by the WHO, and it was observed that low back pain is the commonest observed symptom in 160 countries. So we have kept these points in our mind, and during framing the guidelines, this program was included under National Ayush Mission. Then need for Ayush intervention for MSDs. Prevention and control of non-communicable diseases. There are programs run by the National Health Mission by Ministry of Health and Family Welfare. 60 to 90% of the arthritis patients are use complementary medicines. Then complementary and alternative medicines. No more focused attention is required on musculoskeletal disorders, including osteoarthritis, to popularize simple, safe and effective Ayush interventions in the community for prevention, control and management of the MSD in the mode of a program. So there was no dedicated program for musculoskeletal disorders. So ministry has decided in consultation even with states to have a such program so that the MSD people suffering with musculoskeletal disorders may improve. Basic objective is to improve the quality of life. I am from the Ayurveda stream actually. So that's what, because in the ministry I am working, I am from Ayurveda stream, but I am working from the Ayush systems. So I also expect from your side also, although you are from the homeopathy stream, you also think about the other systems also if they are good, because we prefer allopathy also because it providing effects.
सर आपके वहाँ आपके घर में 3 बच्चे हैं
सर
सबके बच्चों को आप अपने बच्चों को तो आप इक्वल इंपॉर्टेंस देंगे कि नहीं देंगे?
देना चाहिए।
तो आप ऐसा इसको मतलब आप एक बच्चे में सर आप एक जो है आयुर्वेद भी एक उसमें से है, एक होम्योपैथ है और एक सिद्धा है, सबको आप इक्वल इंपॉर्टेंस दीजिए ना, इंपॉर्टेंस क्यों डिवाइड करें?
सर इसमें प्रॉब्लम ये है सर कि हेल्थ हमारा जो प्रपोजल्स आते हैं वो स्टेट्स और यूटी से आते हैं, उनके प्रपोजल को हम थोड़ी कह सकते हैं कि ये मत डालो ये डालो।
सर आप आयुर्वेदा स्ट्रीम से हैं, मैं आयुर्वेदा की ही बात कर रहा हूँ, जो
सर।
एनएचएम में एंगेज हैं, दे आर मोस्टली आयुर्वेदा। For those Ayurveda graduates only, the order has been passed not to fix doctor, not to prescribe their own medicines. And I had from the being, my wife is Ayurveda, so I was in a meeting, I had a very heated argument with the nodal officer of NHS.
No. Actually, our joint secretary ma'am also said me to have some suggestions or your questions. So you can provide your suggestions, your questions to me. I will also appraise to the higher authorities. This was their remarks.
This is the platform.
This was their remarks.
Give our suggestions and the problems also here only.
नहीं,
After the session,
बिल्कुल we will take care of all your issues and I will also appraise to the higher authorities. Even feedback will also be provided to you.
if you want, I had those orders in my phone also.
Okay, I can take from you so that I can appraise to the higher authorities. Okay. Then sustainable development goals. Goal number 3 is good health good health and well-being. And national health policy also encourages for mainstreaming of the Ayush. So therefore we have included this program in National Ayush Mission. Then objectives are to have some management of osteoarthritis and musculoskeletal disorders through Ayush interventions, to improve the quality of life of the people, and then to create awareness through IEC material to empower the people for self-care on prevention of rehabilitation of osteoarthritis. Then strategy, where to implement this program. These are our centers: Ayushman Arogya Mandir, Ayush Dispensary, then national institutes like National Institute of Ayurveda, National Institute of Homeopathy, NIUM, Bangalore. So these national institutes are also situated. 12 national institutes are there. Other linked health facilities if available in your state and UT. So these are the implementation centers. Then what we have to do, these are the some points I have mentioned that I know. One is generating awareness on preventive measures. So you are from the homeopathy stream, so you can use your system. Then screening of the population. Population screening is required for this. Employing yoga, diet and lifestyle. Yoga related already explained by Dr. Raghu sir. Diet and lifestyle is also well explained in our texts, so that you can advise to the patients. Then clinical consultations at your OPD level, or if IPD is available, IPD, higher facilities. Then these are some terminologies used in our Ayurveda, Rasayana. Then periodical cleanings. These facilities are available generally at higher centers. Shodhana procedures are available. Then Varma therapy, this is a specialty of the Siddha system of the medicines, and Unani system is also there for this purpose. I am not the expert of the homeopathy, so I have not included, but you are the people, you know what is to be through homeopathy and what has to be facilities or services to be provided to the people, and also STG guidelines, it is already mentioned, and the resource persons will explain about the role of the homeopathy. Then levels of the service delivery. So first one is the community outreach camp we have to do for implementation of this program. For this purpose, you can utilize the services of UG PG students as a part of their internship or practical experience, or any trained volunteers if available in your state and UT. Then campaigns to create mass awareness, this is required. Then Abhyanga, like oil applications we do. Then yoga, particularly those postures which are likely to cause regeneration of the cartilage and bone tissue. Then diet, exercise, even sunlight exposure is also required. Then use of medicinal plants, spices for various risk and morbidity groups. Screening, management and referral of cases of osteoarthritis. Referral criteria I will explain later. Levels of the service delivery, this is first level healthcare delivery. First was your center, then these are the centers. I am Ayush dispensaries, co-located facilities based on the proximity of the population, units of the national institutes or other any autonomous body related hospital available in your state and UT. Then allopathic dispensary or hospital. If the person falls in that severity category, you can refer the patient to the allopathic hospital or dispensary where these facilities are available. Then levels of service delivery continued. C point, referral facility. Referral facility are those centers generally where the IPD procedures are available. For example, in Ayurveda system of medicines, Panchakarma, Raktamokshana, in Unani system of medicine also there are some facilities which are provided at indoor by indoor services. Depending on the location, these referral facilities can also provide primary health care. Like, suppose there is a Ayush teaching institute and through that institute we are running the program and that institute is a referral center. But that institute can also have a registration of the patients and can provide the primary healthcare services because experts are available at these institutes also. This is the referral criteria to Ayush facility and referral criteria to the modern facility. In our facilities, patients with unclear diagnosis, those having the side effects of the NSAIDs, for those patients who require the expert consultation, further investigations in if in that facility these services are available, and higher level treatment and procedures like Panchakarma, Ilaj Bid Tadbir, your homeopathy services and all. This is the referral criteria for allopathic facility, mainly suspected tuberculosis, malignancy, autoimmune diseases अगर exacerbated है, then uncontrolled comorbidities है, और दूसरा कुछ facilities वहाँ पे available है जो हमारे यहाँ पे available नहीं है, like some testings you have to do and not available in your facility, so you can refer the patient for that purpose also.
सर ट्यूबरकुलोसिस का पेशेंट आप लोग नहीं देख सकते
क्या?
ट्यूबरकुलोसिस का पेशेंट हम लोग नहीं देख सकते
नहीं, you can see, but suppose it is depends on what intervention he required. If it is a severe case of tuberculosis, then we must follow the treatment also. That is National Tuberculosis Eradication Program is going on there. You can give if you are the expert of that. I am saying about if the patient requires to be referred at the higher facility, so you should refer. Then these are the modalities of the implementation. So convergence and logistic support of Ayush health service infrastructure. Ayush department and health department in the states must have the convergence in between them so that the program can be implemented through our facilities and their facilities also. So cross referrals and cross referrals can be achieved in a targeted manner and where it is required. PSC, CSCs and Ayush colleges existing at local level. So I think almost PSC, CSC, DHS sub-centers are available at nearby to the residence of everyone. Then awareness workshop, sensitization training to the professionals. This is also required. This is based on the classification, stage-wise management of each disease and referral criteria, which is explained in the standard treatment guidelines. Then health camps and awareness programs in conjunction with state health facilities. This is to be done. Screening of the patients is required. We have to ensure the continuum of the care. Once you have screened the patient, that patient came to your OPD and you provided OPD services after screening, and then the patient left out, he didn't come for the follow-up, or we have also not keen to have his follow-up to keep his record. But we have to ensure continuum of the care is provided to that patient by maintenance of the record. Then advocacy of the lifestyle and dietary modification in each systems, these are available, so you can advise homeopathy related lifestyle and dietary modifications. Modalities of implementation slide is continued. You can take help of self-panchayat groups, self-help groups and panchayat members for implementation of these programs, for organization of the different camps with their support. Then comprehensive quality is to be ensured. We have Ayurveda, Homeopathy, Siddha and Unani medicines, A, S, U and H, that what we call. So this quality should be ensured. Availability of medicines should be ensured at PSC, CSCs, DSCs and our Ayush centers. Cross referrals between medical colleges and our facilities. Periodic monitoring and evaluation including data monitoring. So these are the prioritized conditions which are already explained by Dr. A. Raghu sir.
From these slides, it looks like our institutions are working like a referral unit. We
No.
have to refer.
No, that's what I have said ki you can work as a primary care center also. You can run a program at your center also, as well as you work as a like hub and spoke. Sometimes a center is a hub also and spoke also.
But the person who are at the hands of affairs are the nodal officers. They don't allow the person working in that center to prescribe their own medicine. They on record say you cannot prescribe your own medicine. You just have to refer these kind of for NCDs also. You know, Ayush has a very good great role to play in NCDs, but still they are forced to refer those patients. And because they have to maintain data also, how many cases.
Then this is data collection, documentation and monitoring. First of all, I am saying that this is a program mode. We are providing support for financial assistance for salary of a Ayush doctor and a multi-purpose worker also, so that this program can run in a program mode. Then data collection and monitoring is one of the important part. This is the data reporting format. So this is already
Under this program, you are providing the financial assistance of 6.6 lakhs per annum.
and 2.4 lakhs per block for campaigning also.
We can recruit a person or a doctor for this particular program.
This is to be done by the state government. Per block you can recruit person. Yes.
MPW.
Yes, MPW also. Ayush doctor and MPW also we are providing financial.
As we can.
As much as you can. Yes. This is to be decided by the state.
Excuse me, sir. It is regarding the Jan Swas Yojana. We have implemented this program since 15th of December. We have opted one block, and we have started the program also. We have appointed a medical officer also and MPW also, and we are working on it since last 4 to 5 months. One thing, the query is there because I am asking the in charge of our Ayush mission, state Ayush mission, the person who is looking after the program in directorate. But I didn't get a clear answer till. I'm just asking you for that. कि एक ब्लॉक में हमने चालू कर दिया है और हमको our institute nodal center has given 2 blocks. आपको 2 ब्लॉक करना है ऐसा बोला गया था. तो एक ब्लॉक में ये जो फंड है ये आयुष मेडिकल ऑफिसर और MPW एक ब्लॉक के लिए अपॉइंट होगा. अगर हमने दूसरे ब्लॉक को चालू किया अभी 1-2 महीने बाद में अदर ब्लॉक ऑल्सो, तो क्या अलग से मेडिकल ऑफिसर की सेम मेडिकल ऑफिसर will be working in the other block also?
No, that's what I am saying, ma'am. Ki this is 6.6 lakhs per annum for manpower. They may be assigned 1 block, 2 block, 3 block. The 2.4 lakhs is this is for per block. So this is to be decided by your state how many blocks they have to cover also.
नहीं, they told कि 2,40,000 तो हमको एक ब्लॉक में ही खर्च करना है पूरा, क्योंकि हमने मोडस ऑपरेंडी 1 साल का बना दिया. लेकिन जो ये आयुष मेडिकल ऑफिसर का पेमेंट है 40,000 और वो तो क्योंकि एक बंदा एक ही ब्लॉक में 1 साल काम करने वाला है, तो वही बंदा दूसरे ब्लॉक में हमको अलग से अपॉइंटमेंट वो 6.60 है जो 6 लाख 6.5 लाख रुपए, ये दूसरे ब्लॉक के लिए अलग से मिलेगा क्या?
Ma'am, state अगर if state demands, so we can provide.
Sir, this is the guideline of the central to the state. तो यही गाइडलाइन अगर सेंट्रल की है ना जो स्टेट फॉलो करेगा, तो स्टेट क्यों डिसाइड करेगा? आप ही बताएंगे ना सर.
मैम, स्टेट तो ये भी कह सकता है कि 3 ब्लॉक में आपको काम करना है, जाके इसका डाटा कलेक्शन करना है.
वो कह सकता है लेकिन नहीं पॉसिबल है ना, तो जो गाइडलाइन सेंट्रल की होगी वो फॉलो करना है कि नहीं उनको?
योर पॉइंट इज नोटेड डाउन. उनको फॉलो कर. आप फ्रॉम विच स्टेट यू आर?
आई एम फ्रॉम मध्य प्रदेश, भोपाल.
आई विल स्पीक विद डॉक्टर राजू मिश्रा आल्सो.
एग्जैक्टली.
Sir, what about the medical officers who are already in the dispensary level SHDs or SADs? They have been asked by the state to take the additional responsibility of CHO, and they are not been provided that 15,000. They are only been provided. I don't know about other state. I don't know about there. But in our West Bengal, they are only providing the Ayush medical officer the incentive of 5,000 only.
Because they are regular doctors.
Because they are regular doctors. Now this has been implemented by Central, and Central has told that where there are regular doctors, you should not take CHO from outside, and state is implementing it. Now you say, sir, if we are to take over all the responsibilities of HWC, then there will be NABH inspection where we have to maintain 24 registers. We have to see all the patients. We have to screen for diabetes and hypertension every day, which I am doing personally. So I am saying, is this possible?
Not possible.
Sir, this point has been discussed that already our Ayush doctors are.
Uniform that
All the data is there.
HWC, there should be a head.
So your suggestion is even if there is a regular doctor is available, there is a need of another CHO at that facility.
He will be the supervisor.
So
The medical officer might be the supervisor of all the HWC.
sir, your I have noted your suggestion.
एक्स्ट्रा काम के लिए एक्स्ट्रा पैसा मिलना चाहिए.
हाँ मैं समझ
As
गया.
of now, sir, whatever you have mentioned, what has happened in our state also is that under this program only that attender is been appointed. The work has to be done by the regular doctors
I think
only. And
one point. Our next speakers, they are from your stream, homeopathy stream, so they are waiting, and we will take all of your suggestions in written.
And we have a feedback session also at the end of the day, so you can prepare your questions and
Yes.
ask during the feedback session. So may I kindly request the next speaker to
इसमें सर जो योगा वालों का
Join.
रेम्युनरेशन तय किया है ना, वो आपने कितना तय किया है?
नहीं इसमें योगा का रिम्यूनरेशन है नहीं सर, इसमें नहीं है. योगा इंस्ट्रक्टर्स आर अवेलेबल अंडर आयुष्मान आरोग्य मंदिर सर.
Yoga instructor also need to be engaged here. Is it not required to engage the yoga instructor?
If it is available,
Which one they will be paid from the contingency 2.4?
no.
If we
Sir, at Ayushman Arogya Mandir already yoga instructors are available. You can avail their services.
they are for the SWC. They are not
Sir,
for the-
sir, we have to implement this program through SWCs also.
They have to conduct session there. But when we want to conduct some
Dr. Virendra,
Sir,
I have a
Okay.
request.
one
Next
last,
speaker is
one
waiting,
last,
so could you please
last
do it?
This is our data reporting format. These are the 11 points. Then I will just see, this is a 36 questionnaire, SF 36 questionnaire. How the quality of life is improved. This is symptoms to be mentioned. Patient is asked 36 questions, and based on before and after treatment, so what is the improvement in their symptoms, so we can ensure that the quality of life has been improved or not. Okay. This is the, I think you are all aware about SF36 questionnaire. This was hyperlinked. So I will share this PPT with all of you also. Okay. हाँ बिल्कुल करना पड़ेगा. I expect you will provide this training to your counterparts in your state and CHOs also. ठीक है. So next I will head over to the next speaker. Your questions please give me in writing
Make
also.
one group of this thing, sir, WhatsApp group, so that you can share whatever this thing.
Yes,
And in
noted,
future also
noted. And your suggestions you will post in that group. Okay, thank you.